Call the now 3:30, there we are, now we can hear it. We will call the now 3:30 becoming 3:48 meeting of the Planning Committee. Thank you, Dr. Weber, and all of your affiliates and Quality. Thank you all for being here. We have a reasonably long agenda today, so we're going to try to get started. I'm informed of no citizens wishing to address the committee, so we'll move straight to the minutes of the July 7th, 2006 meeting and entertain a motion.
Move approval.
Have a motion from Dorothy.
Second.
Second from Chuck. Any question or discussion? All in favor say aye. All opposed, same sign. That motion carries. Thank you very much. That will take us to Angie, who I know is ready in the wings because she was offering me all of her documents since I couldn't get on the portal. So Angie is ready to go. Agreement for architectural services for the emergency department expansion. Is that me? Thank God, no. Into existing shell space project between Tarrant County Hospital District and Sterling Barnett Little Inc. Welcome, Angie.
Board Chair just told, this is our proposal for emergency department expansion. If you'll remember, in our east expansion for interventional radiology and cardiology, we built out a shell space for future ED expansion. We budgeted for it in FY17. The first part of any project, we've got to get an architect on board. I will tell you that every architect that responded is qualified. There's a lot of good architects out there. But in narrowing it down, the evaluation team selected Sterling Barnett Little. They're a Tarrant County firm. They are out of Arlington. We negotiated at 8.5% of construction cost. So their contract overall should be about $261,800, and that's what I'm here today asking for approval for. And they did exceed the district's hub goals. They're at 34.29%.
All right, any questions for Angie?
Move for approval.
All right, we have a motion from Charlie,
Second.
second from Dorothy. Any question or discussion? All in favor say aye. All opposed, same sign. Thank you very much. Appreciate it, Angie. That will take us to the agreement for architectural services for radiology equipment between Tarrant County Hospital District and LBL Architects.
Okay. Again, several qualified architects responded to our RFQ. In the FY17 capital budget, there were several pieces of radiology equipment that need to be replaced, so they were budgeted for. I've listed them in the first paragraph. It's general radiology at the main campus, an additional MRI. The Viola Pitts Como Clinic needs the general radiology equipment replaced, and also for Tarrant County Correction Center downtown, that radiology piece also needs to be replaced, so it's all of those. If you look over that and wonder, 9% of estimated construction costs, so that's a 0.5% higher. That's because each of these will be a separate set of drawings, has to be. So it's a little more work for the architect on this one. We are recommending LBL. They're also a Tarrant County firm. They're out of Fort Worth. We do have some history with LBL, and we find them, their drawings are very tight. There's just very few mistakes. You don't have to go back for much of anything. They also exceeded our hub goals at 45%, so we're really happy to see that. Overall, their contract should be about $207,900 to be adjusted, based on the actual construction cost. And that's what I'm here to ask approval for today.
Okay, any questions for Angie? If not, we need a motion on the radiology equipment installation.
Move approval.
Motion from Roger, second from Dorothy. Any question or discussion? Warren. Oh, was that Warren? I'm sorry. Warren, I apologize. I'm trying to listen and look at the same time. We're just not that coordinated. Hearing no questions, we'll call for the vote. All in favor say aye. Aye. All opposed, same sign. Motion carries. Thank you very much. And now to the Northeast Tarrant Medical Home Project budget. Angie?
Yes, sir. And I do have an additional handout. It was brought to my attention that my floor plan in your electronic book, the colors didn't show up well, and it's also nice to have all the words spelled correctly. This is to request the approval of the Planning Committee for 4,197 additional square feet to the 30,000 that we budgeted and planned for out at Northeast. The additional square feet are for an optometry suite within the clinic. And if you read, the diabetic patients need an eye exam once a year. Our ophthalmology, clinic here at the hospital is really, really busy. This lets them come out to the clinic and get that done in the one-stop shop that we're proposing. Also, some additional square footage for undergraduate medical students that rotate through Northeast under the supervision of longtime faculty members. And so they take 2 students at a time, and, that's just square feet. There's 12 students out there, so we've got to have room for them if you approve. Lastly, the partial hospitalization program. As you're probably aware, we lease space out that way for a partial hospitalization program. It seems to make more sense to bring it into the building we own instead of continually paying a lease. So those are the primary drivers of the additional square feet. This is a lot of money, I know it is. We're budgeted at $294 a square foot at that clinic. So overall, if you take in the additional square footage times your $294, we've got a low contingency at 5%, and then additional architect's fees if the project comes in like that. So we're looking at requesting an additional, gosh, I'm choking, $1,295,614 for construction cost, and then another $110,127 for professional service fees. That's what I'm looking for.
Angie, would any of this qualify for additional DSRIP assistance? Or is this all classified capital that wouldn't allow us to leverage any DSRIP dollars?
Trent, that's a good question, and I wish I had the answer for you.
Yeah, my gut feeling is it will not.
Just because of the capital cap?
Yes.
Okay. Well, you've heard Angie's recommendation. Roger, you have a question?
Is there anything else that might need to be added to this facility?
I'll tell you what, Roger, this is what I said. We're coming to the board one time and one time only. We've never come to the board for additional money since I've been the director.
You have 3 board members from that area, right?
Yes, yes. But yes, we believe it's, no, sir, we do believe this is the only request. And at that 294, we'll pick up everything. We do have a contingency built in if anything else comes up, if the city requires us to do anything different that we didn't catch in our number. But we believe this number will get our, well, and we have. We've negotiated with them on a couple of things already, and they've been very, very willing to work with us, so no complaints there whatsoever.
Well, I applaud, frankly, the relook, and to the extent that certainly optometry services are in demand all over the district, and if we can make the medical home model more efficient and provide a service up there, that would be great. So I know the 3 of us that live up there are going to highly support this. Any other questions from board members? If not, we entertain a motion.
I'd move for approval. We've been waiting a long time for this one.
Have a motion from Charlie, a second from DT. Any question or discussion? If not, all in favor say aye. All opposed, same sign. That motion carries.
Thank you.
Thank you very much, Angie. We appreciate it. And stay with us, because now we're going to have our network design construction project report.
Okay. Well, you just got a little briefing on Northeast. Additionally, the final site plan will go to the city tomorrow for review and approval. We're about at 80% design development. We are anticipating having this out for bid and award from February to April coming up. So watch for me to come back at a April-ish planning committee for approval of a contractor and the overall budget. And, at that time, we'll know our actual number. The ED expansion into the shell space, again, y'all just got a briefing on that, so this will be quick. Radiology equipment construction, same thing. Architect, looking for that. Northeast Clinic cleanup or demo. Right now, what we've done out there at Northeast is cleaned up both of those buildings that we own that are vacant and made them safe. They are old, so they can be put on the market for sale. So that's where we're at there. TSP Phase 3 patient rooms. That project is to replace all the patient room doors and bathrooms with anti-ligature hardware and, make them safe. So that's coming. Also, we're preparing the bid documents right now, and we'll be back at a future planning committee to ask for permission on that one. Any questions?
Do you have to have a vote on this one, Angie,
No,
or
so
not?
that's the report on
It's
that.
just another.
Great. All right. We appreciate that update. If there's no questions, then we will move on.
Thank you.
Thank you very much, Angie. We appreciate it. Okay, next is item 4B, which is the Tarrant County Long Range Planning Analysis related to Tarrant County Hospital District Health Management Associates. I'm going to introduce GK. who will introduce this team. I think most of you, if not all of you, have had the chance to visit with these folks by telephone. I got the opportunity to do that this week with Dr. Duncan and Mr. Lyons and his team, and really appreciate the time you guys have given us to have an opportunity to visit with you and provide feedback. So we're looking forward to hearing from you today. Mr. Mangus.
Thank you, Mr. Chairman, members of the committee, good afternoon. You know, it's interesting working with a group of professionals like HMA. We have been working with them now as our consultant and your consultant on this particular project, and quite frankly, as far as the county administration is concerned, we're very impressed with their efforts. So what I would like to do today is simply introduce Warren Lyons. He can introduce his team. Warren is the lead principal in this particular effort. And Mr. Petty, I know that you're moving fast, so I'm going to leave it at that.
Welcome, team. We're glad y'all are here. Appreciate you being here today.
Well, thank you very much. Again, to echo GK's appreciation for your time that you've spent with us. So we hope to get through this slide deck and to learn, as we always try to do, how to do things better in healthcare. I'm pleased to be the director of this project coming out of the San Francisco office. For those of you that haven't talked with me directly, my background is hospital administration, and that's what I've done in my career, and I love it dearly. And I can't think of a better thing to be doing than working on the healthcare, especially for vulnerable populations. We do have a team on this project. Most of them are not here, but two are, and I'd like to introduce Dr. Karen Duncan to my left and Lori Weiselberg to her left, who are part of our engagement team. Dr. Duncan is a pediatrician, and I'll let her and Lori make a few comments about themselves. It's important you get to know us that you haven't met.
First of all, thank you very much for giving us this opportunity to come before you. I'm Karen Duncan, and as Warren said, my profession and what I practiced for a number of years was pediatrics. That was with Grady Health System, which is a large safety net hospital in Atlanta, so I am Southerner also. I was in the community. I have a lot of interest in community and how it is that you can take medicine into the community, and have had a lot of experience with that. After a number of years of practicing pediatrics, I stepped into medical leadership and helped lead some of the physicians in the community, and then was asked to move into the hospital to oversee all of the ambulatory services, which included the specialty services. So again, thank you for giving us this opportunity.
Great, thank you. So I'm Lori Weiselberg. I'm a principal at HMA. I've been there for about 11 years. My background's in public health, and I've always focused on population health and prevention. In the last 20 years have focused on primary care improvement, usually in the context of integrated delivery systems, and have worked in primarily public systems and federally qualified health centers, so always working with vulnerable populations, underserved populations, and came from Cook County Health and Hospital System prior to coming to HMA.
Cook County being the home of the Chicago Cubs, is that right? Just checking. And I realize it may not come back again for another 100 years. There now.
Actually, it's 108 years because it's 108 stitches on a baseball, so that'll be the
There
next
you go.
century.
There you go, Warren.
Well, I'd like to just take a few minutes of your time, go through the slide deck that you received on your e-portal, and give you a briefing and update, as we have promised to do, on this very important engagement for JPS Health Network in Tarrant County. As a background, we have been on the ground since early September and have had the opportunity already to begin moving both the analysis portion of our work and, equally important, to listen to the voices of the community, beginning, of course, with the court and with this board. We're going to cover a few things today, and it's mostly process-oriented, but process is important when community engagement is vital to planning the future for public health in Tarrant County. So we'll give you a little bit of an update on our project, talk about the stakeholder interviews and community forums that are underway, the public website, which is live, a little bit about delivery system update, which is a major part of our work, the facilities plan RFP, which has been released, and the Blue Ribbon Committee. So I hope that addresses most of your interest this afternoon. It's important when we talk to diverse populations to have a consistent message. So we're using this page's statement of what is this all about, so that wherever we go, whether it's one-on-one interviews with external stakeholders or holding a community meeting, that we are consistent in describing that the project is based upon information to be received to make informed decisions to improve the health status. It's not about hiring people, it's not about buildings, it's about what is the outcome in terms of the health status of the county and its various populations, many of whom, as you know, are increasing in size daily. Communication is key to our engagement because we're going to learn a lot from all of you. So we do a monthly in-person update to the court. We're doing an update with this planning committee today. GK is burdened with listening to me and my team weekly with Scott and Marianne to talk about where we are. And we also use some written reports and dashboards which will be on the county's website for long-range planning and analysis so that anyone can be assured of what is being discussed, the time frame, and the recommendations or preliminary findings that would be posted on the website. Hard to read on the screen. Hopefully you can read it on your e-portal. We use this dashboard to advise Tarrant County and JPS of the various portions of our project, the timelines, what's been done, what are the upcoming tasks, who's assigned to it, and to assure that we're on time. And we use this document along with a written narrative to be assured that we are responsive to course corrections, the guidance we might receive from this board or from Tarrant County on the work that we're doing. Stakeholder engagement is key to this whole process, listening to the voices of those who care and those who have both opinions and concerns. We have set up a number of ways to do that. Community forums that we'll be discussing shortly, focus groups, talking to community leaders, other healthcare facilities and health organizations, elected officials, and of course, JPS Board of Managers. Community forums, a very important part of our process. You can see the outline of how we hope to conduct those, and we do have some dates for them that will be posted shortly. One for each precinct, about 90 minutes long, translations in Spanish and Vietnamese. It's a listening session, and as Lori, who is our subject matter expert on this, certainly says, the last thing we would want to do is have a 30-minute lecture to community members who came to say something to us. So it's very much a listening session to gain input from the community and to make sure that we summarize what we learn in a way that is actionable. The outline of our forum agenda is pretty straightforward, and we're going to hopefully allow for conversation that leads towards further input through our website as people begin to talk about the future for healthcare in Tarrant County. We also have two focus groups, one of which we had this morning, and one we'll be having this evening with your Patient Advisory Council. And these are important structured ways for us to listen again and ask for opinions on the future of healthcare, what might be opportunities for additional types of deployment of programs and resources so that the end result is improved population health. I'm going to ask Lori Weiselberg, who chaired this morning's meeting and will be running this afternoon's Patient Advisory Council meeting, to have a few comments about what was our first group session to engage the community.
So we met for close to an hour and a half. We invited the JPS Joint Council, and We got 8 representatives, which was exactly what we were targeting, and they represented a really diverse set of populations and issues, from cancer to other social services, aging services, faith-based organization, free clinic, Meals on Wheels. Yeah, so it was a really diverse group, and we had a set of guiding questions, and they conversed with one another the entire time, and there were very clear themes that emerged, and so this will be an easy write-up, and we'll see what the next one holds, and that will be at 5:30 today.
Individual stakeholder interviews, as you know, are ongoing, and the plan is to do some of these in person where that's appropriate. Many of those can be and will be done by telephone. And oftentimes, we'll have subject matter experts besides the 3 of us interviewing the appropriate persons. For example, one of our team members is Dr. Maurice Lemon, who's the former Chief Medical Officer for Cook County Health System, and he's going to have a conversation with the medical school leadership here in Tarrant County. He shares their DNA in having been involved with academic medicine, and so he's the appropriate person to have a conversation about medical education, both undergraduate and graduate. We have other members, for example, who is Ray Jankowski, who's a chief financial officer and actually a chief executive officer of a hospital, talking to the finance folks. So we try to be sure that the interviewee feels that the interviewer has some shared competency and knowledge about the subject matter. We've also completed, as you know, the interviews with this board and with the Commissioner's Court. And they've been really excellent, and I want to thank again all of you for your contributions. This, on your e-portal, is a list of the categories, and I think we've covered the horizon in terms of the kinds of individuals, whether it's philanthropy or hospitals or educational affiliations. Some people, not I think you, would be surprised, why do we have law enforcement on a healthcare effort? Well, as you so well know, many of our law enforcement and correctional health issues are urgent matters, and many of our, unfortunately, behavioral health patients find themselves in the correctional health system. So that's an example where, with your guidance and GK's, we are interviewing the leaders within the sheriff's departments, the police departments, to learn their frontline perspectives on populations that are in need of support. Public website is up. It went live on October 31st. If you go to the Tarrant County website, you will go to long-range planning and analysis. And with GK's guidance and Scott and Marianne, we've designed a website that would be an ongoing process to share with the community the project, its timeline, the information, in a way that hopefully improves learning abilities of our engagement. There are going to be links to public documents. Questions can be submitted from the public, and we will have a welcoming statement in Spanish and Vietnamese. And if there is an inquiry in a language other than English, your excellent JPS team are going to catch that ball and get it translated in an appropriate response to an individual who might want to talk in a language other than English. There's a screenshot of the website. There are several platform pages below it. I won't go through them all with you, but I think that the beauty of digital translations here is that if we find an improvement, if any of you look at the website and say, you know, there could be something different here, clearly our tech team within the county can make adjustments to how the Pebble website is designed and the wordings. So it's a flexible document. The original engagement for HMA included that we would interact with a second request for a proposal from a firm that would review the actual architectural and project construction documents that all of you have worked very diligently on. That RFP was released, and there is a pre-bid conference on next Monday. The reason why I mentioned that is that part of our work for you and for Tarrant County is to assist in writing the RFP specifications. I will be listening in on the video, and to be sure that that second firm is a process that links clearly with our work, so we don't have redundancy or time delays, but actually have synergies. So I'm very glad that we were asked to participate in that second RFP process. At the end of the day, it's how delivery of healthcare and social services are given to our vulnerable populations. And I just wanted to remind this board and the public who might be listening in on this video that HMA brings to our team, in addition to Dr. Duncan, a large group of clinically trained physicians, psychologists, clinical social workers, doctoral nurse practitioners who, as they begin to work through the delivery system side of JPS and the county, do understand that knowledge and can make pertinent observations as we go through the engagement. Finally, there is a Blue Ribbon Committee, and I'm going to ask my colleague GK to make some comments about that. We are prepared when that Blue Ribbon Committee and with the liaison from Trent and Dr. Weber are in place to provide that support and educational resources to the Blue Ribbon Committee. GK?
Just one quick, because you just gave Dr. Weber a little small cardiac arrest. It's going to be Dr. Lowry. So what you did, and
I know
don't
it
mean
was
to,
a doctor.
I never mean to correct you, Warren, but I want to tell you that for one moment, Dr. Lowry was really excited, and Dr. Weber was really concerned. So now we got them both in their right places.
But just to make you feel better, people frequently mistake Reverend Emerson for me. You see the resemblance?
Yeah, I did.
Got that correction. Thank you.
Okay.
Well, Dr. Weber, if you're going to have a heart attack, this is the place to have it.
Surgeons have learned to deal with these little
I understand.
New committee appointments.
With committee appointments or heart attacks?
Yeah, both.
Yes.
They're similar.
Yes.
Yes, they are.
On the Blue Ribbon Committee, as you know, the committee is going to consist of 10 members and 1 chair. We're reviewing the chair issue right now, but the Commissioners Court has appointed 9 of the 10. I think we're going to pick up our 10th appointee out of Precinct 4 next Tuesday. And then we will be discussing with the court the chairperson that will be leading that. Obviously, the board here has 2 liaisons to the committee, and the Commissioners Court will have 2 liaisons. And their roles are really to be participants in the Blue Ribbon Committee, but also to be communicators back to both the Hospital District Board and also the Commissioners Court. So I think we're moving fairly or on time, on our timeline at least, on what we were intending to do with the appointment of the board. I think with the work that HMA has been doing, plus the second consulting group that we'll be bringing on probably at the first part of December after we analyze the RFPs. They're working together with the board. I think the Blue Ribbon Committee, I think we're going to really get the end product that we're looking for.
And just so Mr. Manius and the HMA team know that our website, and y'all know, our website is linked to the county's website, so it's sort of a synergy between the two. We can easily pull up our site, and you can link to your site, and vice versa. So it's really helpful. Our communications team has set that
We
up.
had that bullet up on the PowerPoint, but I'm glad that you brought that out because it's absolutely critical that whoever wants to view all the documents, all the meetings, can go to either site and access that data.
Exactly. Thank you.
Mark.
You bet.
Just in conclusion, HMA often has clients similar to this that are not ready for work. And I have to assure you that this is not the case here. The county and JPS staff have been most responsive to the inevitable consultant's request for data, because that's what consultants do initially, is ask for data. But I can tell you from personal experience with some other clients that I wish they were like this client. So we want to thank you also for the fact that your team really is helping us do our job in an effective and an efficient way. And that's sort of our presentation for today. Be happy to hear your conversation, answer any questions, and go from there.
Great. We appreciate, Warren, you being here, Dr. Duncan, Ms. Weiselberg, the time you've spent with each of us, talking to us. We deeply appreciate it. Mr. Manius, the opportunity to come and visit with planning. We want to keep that door wide open for you. Anytime we can be of assistance as a committee, we certainly want to do that. I applaud the format and the work that's been done to date to prepare for this. Clearly have the right people working on our side. So with that, I'll open the report to any questions of members of the committee.
Or are two representatives?
Dr. Lowry and I are the liaisons. It was almost you for a second.
Yeah, you almost had it.
All right, I'm not here. Warren, you have a question? Sure.
Warren?
Yes.
Yeah, well, as a fellow Warren, I have to know that I've set the bar pretty high here, and so we'll expect brilliance, bravery, boldness, all those good things. So,
Thank you.
just making sure, yeah.
I'll do my best to live up to our namesake.
Yeah, there you go.
Any other questions from DT?
I have a question on page 11. Is there a possibility to add to the list, maybe the VA? Because we have a big population.
We do have the VA.
They're on the list. Okay.
Under health
I see.
facilities and organizations.
They're part of, yeah, they're part.
Good question. Any other
Very important one, too.
questions or comments from the committee?
Mr. Petty, if
Yes,
there's
sir.
no other ones, if I might just say a word.
Sure.
Two things. First of all, I want to tell you that your staff has been just an absolute strong team member with our staff on this. And they are included, they're part of our team, and that relationship is very, very strong, and we work well together. And second of all, just a personal comment. You know, ladies and gentlemen, I've always been impressed with JPS. But the other morning, I had the privilege of being at a function here on the ground, even though it was at 7:30 in the morning. You know, after listening to that program, first of all, it was extremely well done. And those of you who were there know, realize what I'm saying is absolutely true. But it absolutely takes your breath away on what you all do at this hospital for our community. And I want to thank you for that.
Great. Thank you all. Again, we appreciate it. We look forward to hearing more from you. There's no